Like any human practices, medical practices are inherently socially constituted. That is, they always happen in a social setting. So do things happen to our biological bodies? Of course they do. Absolutely they do. Good things happen, bad things happen. There are things that happen to our biological bodies that might seem good in one context and not good in another. Kind of funny to think about, but true. So yes, we have physical biological bodies and things happen to those bodies, but how we think about what's happening to them, whether what we see counts to us as health or illness, or maybe the transition between the two, or somewhere in the middle, all of those are socially constituted. And so the domain of medical anthropology is to really identify where society and culture comes in to interpret and give meaning to the things that are happening to our body. So like any human practice, like rites of passage, like burial practices, like joke telling, like games, like racial constructions and gender and kinship and everything else, medical practices are socially constituted. They always happen in a social setting, and therefore they're a product of a particular set of beliefs of the society in which they're being practiced. Because of this, you may not be surprised to learn that within every society there's a continuity between what we call etiology, diagnosis, and treatment. In other words, there's a logical continuation between what people believe is the cause of a sickness, so the etiology, the philosophy, or the belief about the cause of the sickness, so the etiology, the diagnosis, the process of identifying what it is that's wrong with the body, the social body or the individual biological body, and then what would be the process of treatment. And so if you believe that a germ is the cause of disease, then the process of diagnosis would be a microscope or some other kind of detection device to find the germ, and the treatment would be treating the germ. If you believe that the cause of an illness is is a spirit that's entering into your body and wreaking havoc and throwing germs that shouldn't be there, then yeah, you might acknowledge that there's a germ over there, but the process of diagnosis would not be to figure out the germ, because that's kind of the outcome, right? The cause is that spirit. And so the process of diagnosis might be some kind of divination, maybe a shamanic divination or some other kind of divination of identifying which spirit it is that's in your body and what it is that it wants. So that would be the process of diagnosis. And then the treatment would logically be getting rid of that spirit. Yes, the germ is there, and maybe in the meantime you could take an aspirin or some kind of medicine to get rid of that germ, but really that's not getting rid of the cause of the disease. My etiology was that it's a spirit that's harming you, and my diagnosis identified which spirit, and so the treatment, the real part of the treatment, would be getting rid of that spirit, allowing that spirit to exit your body, to change its mind about you or whatever. And so there's always a continuity between the etiology, the diagnosis, and the treatment processes.